I would say my greatest source of inspiration is my clients. Day in and day out, I get to witness these amazing transformations of these amazing human beings who are dedicating, so much of their lives to live to their fullest potential. And, through our Living Light Metabolic Reset program, we've seen people who have been able to, according to their medical doctors, be cleared of cancer, have their fatty liver disappear.
Many people who are listening to this may have a belief that they can't heal or things are the way that somebody else told them they are. And remember, your doctor's opinion is just that. It's an opinion. It's not always a fact. We get to decide what the facts are based on our behaviors, based on our beliefs and our actions, and how committed we are to making those things come to reality. Nobody wants to wait until they get sick to learn how to be healthy. What everyone wants for themselves and their loved ones, especially their children, is to know how to be healthy from the very beginning. And if they can learn how to take the best care of themselves from the moment they're born, or parents can learn how to take care of their children from the moment they're born and model health to their children, that's the world I want to live in. And the greatest gift that you can give to future generations is to take good care of yourself, because especially between the age of 0 and 7, you're modeling your child's worldview. You're modeling what a healthy diet is. You're modeling what healthy communication is. You're modeling what a healthy self-talk looks like. You're modeling what a healthy environment looks like. You don't want them to wait until they're 40, 50, 60 and sick and then realize that you had it wrong as a parent the whole time, right? You want them to be grateful for the environment that you created. Hello, dear health seekers, and welcome to the Living Light Show. I'm your host, Sachin Patel, with my dear co-host, Dipa Chauhan, and we're going to be taking you on a journey of exploration for all things related to metabolic health. Our goal and objective is to bring you simple, practical, and actionable steps that you can put into place immediately so that you can improve your quality of life, your metabolic health, your body composition. And as many of you probably already know, our metabolic health is tied to so many different areas in our lives, not just the way we look, but the way we feel, and also, most importantly, the way we function. Our objective is for you to learn, for you to apply, and for you to benefit from the information and the special guests that we bring to you. Without further ado, I'd like to introduce and bring onto the show my co-host and my lovely wife and partner in business as well, Dipa. Dipa, thank you for joining me today.
Thank you for having me. Super excited for this first episode of ours.
Yeah, we've been putting this off for a long time, and there's no better time than now. So here we are. And, I'd love to start off by perhaps sharing a bit of our stories. And so I'll ask you a few questions about your story. Maybe you can ask me a few about mine, so our audience and our listeners can get to learn a little bit more about our values, our objectives, our backgrounds, and why we do what we do. So how about I start with you? And let's start with, what is your source of inspiration when it comes to metabolic health and wellness?
I would say my greatest source of inspiration is my clients. Day in and day out, I get to witness these amazing transformations of these amazing human beings who are dedicating, so much of their lives to live to their fullest potential. And, through our Living Light Metabolic Reset program, we've seen people who have been able to, according to their medical doctors, be cleared of cancer, have their fatty liver disappear, have, amazing physical transformations, as you said, 20 to 30 pounds of weight loss. And really what that translates to is them being more fully present for their families and their children and their communities and their careers. And it's just this wonderful ripple effect that takes place when we prioritize our health and our self-care.
Awesome. Now, neither one of us started here. We are here now and doing the work that we do. You started off as a pharmacist, so maybe you can tell us a little bit more about what inspired you to be a pharmacist, and then what inspired you not to be a pharmacist anymore and go into the functional medicine and holistic lifestyle route.
So, my journey with pharmacy, I guess when I was in high school, that's around the time where they have you start thinking about what career path you want to go down. And I always was interested in science, always knew I wanted to do something in healthcare, but knew I did not want to be a medical doctor. So, we had a few family friends who were pharmacists, and my mom, really encouraged me to go down that route because she said that there's a lot of flexibility with your schedule, especially, if you ever decide to have kids down the road. And so I looked into it and I decided to pursue my career in pharmacy. So when I graduated, I did a 1 year residency in hospital pharmacy. I really wanted to, you know, be more involved in hospital pharmacy rather than community pharmacy. I didn't want to be ringing up people's toilet paper. So I really wanted to get more into the clinical side of things. And so I did the hospital residency. And then shortly after that, I was working in the oncology department at St. Michael's Hospital. And when I started down that path, I think that was probably around the time that you really started getting into functional medicine. And I know you would share a lot of things with me. And so that's when my interest in functional medicine started to develop. Of course, I had just started my pharmacy career, so I really enjoyed my job at St. Mike's, but I saw people coming into the oncology department and really, going down this spiral path of downward health where they really weren't getting better. Many of the nutritional advice that was given to them was just eat whatever you can, eat these sugar laden ensure shakes, and something just didn't seem right to me about that. So fast forward a few years later, I continued with my pharmacy path for a few years, and then I moved to the US. A year into moving to the US, I got pregnant, right, with our son, Devin. And I guess I had a very, wonderful pregnancy, very healthy pregnancy, but I, had a pretty difficult and challenging labor and delivery. I almost lost my life. I had to have 3 surgeries. And of course, at the end of that, my health was not in the greatest shape, right? I had this newborn that I had to take care of. And I know at that point you were pretty much, transitioning it more so into the functional medicine realm. And so I know that you had really guided me on my journey to recovery. I was able to basically go from not being able to breastfeed Devin to 9 weeks later, fully being able to transition into fully breastfeeding him. And I believe a lot of it had to do with the lifestyle and nutritional changes that you had supported me with, along with, my family, my parents. And so, I really do truly believe in the power of lifestyle, the power of nutrition, and how it can transform someone's life. And I see that day in and day out. And so, just probably, I think it's almost 3 years now, I decided to retire my pharmacy license. Since then, I have obtained a few functional medicine trainings. I went through Functional Medicine University, and then just more recently, I became a functional diagnostic nutrition practitioner as well. So that's a little bit about my journey in terms of what brought me to this point.
It's quite the journey. Thank you for sharing. And I recall many of those days and nights where you persevered and overcame, what seemed to be unsurmountable obstacles. So grateful that you were able to breastfeed Devin, even though you were told that you would never be able to do that. And so, I think this is a great place to kind of reflect on what we believe to be true. Many people who are listening to this may have a belief that they can't heal or things are the way that somebody else told them they are. And remember, your doctor's opinion is just that. It's an opinion. It's not always a fact. We get to decide what the facts are based on our behaviors, based on our beliefs and our actions, and how committed we are to making those things come to reality. So you definitely did some amazing mental gymnastics to overcome some of the challenges you did overcome, and so gracefully. And of course, it helps having a wonderful support system. Your parents were amazing, I know my parents played a role. The inspiration of having a young child, that was obviously something that drove you and certainly drove me to be better and do better. And so it's important for us to kind of all attach to something bigger and beyond ourselves if we want to overcome what seem to be very challenging and unforgiving circumstances. And it's not an easy thing to go through what you went through. And I know you only gave like a tip of the iceberg of the story, and maybe we'll unpack that in future episodes so people can really get a sense of what you went through and what you overcame to be here right now. And I love the fact that you bring this awareness of what the body and the mind and the spirit are capable of into your practice, and how you guide clients through their journeys and help them overcome their mental hurdles and obstacles is amazing. And every day you're posting case studies and sharing people's stories and journeys of transformation. It's beautiful to witness, and I'm so glad that our paths have crossed, and not only in our personal lives but also in business, because I see how much dedication you have and commitment you have to taking on a client and ensuring that they're getting amazing results and outcomes. So thank you for the work that you do and continue to do. And truly, you're the backbone of our family and the backbone of our business. And I want to make sure I mention that to everyone, because sometimes, I probably get a lot more credit than I deserve. I tend to be the face of things at times, but people need to hear that you are the backbone and make it all work and come together in such a amazing and profoundly synergistic way. So thank you for the work that you do. And I also know, and it's probably worth noting, is that this is not your comfort zone, right? Like, it's also taken you a lot of courage to be able to put yourself out there and become the face of our organization. And I want to acknowledge you and, just let you know, I admire you for doing that, because not everyone has the courage to put their message out there in the world. And you have such an important message to share. So I'm grateful that, I can witness that and facilitate that in any way. So thank you for that as well.
Well, honestly, a lot of what you said wouldn't have been possible unless I had your support. So I want to put that out there too. You always push me to be a better person, a better human being. You remind me that I have so much potential, and that we all do, really. And it would not be possible, any of it, even my journey through the hospital and working together, as you mentioned, being in this position right now would all not have been possible if it wasn't for you and your love and your support. So I'm super grateful for that. Super grateful to have such an amazing partner by my side.
Wonderful. I received that. Thank you, Deepa. I appreciate that very much.
Thank you. So why don't you tell me a little bit about your journey and how you came to be in this position of, being able to help other clients and practitioners, and switching from your traditional role as a chiropractor to where you are today?
Yeah. So, chiropractic is very interesting as a profession, because once you're a chiropractor, you're kind of always a chiropractor, because chiropractic is a way of life. And, people may think of chiropractic as a procedure, but it's so much more than that. It's not just cracking backs and adjusting people's necks and manipulating their soft tissue, which is a lot of what I did initially. It's really like looking at your body through a very specific lens and looking at your body through the paradigm of innate intelligence and this deep understanding and awareness that you are not just a fluke, you are a miracle. And each and every single day, your body has the ability and the capacity and is being reborn. And you have new cells every single moment. In fact, during this conversation, millions of cells have silently replaced themselves with brand new cells. Now it's up to us to take the best care of them and provide them with the right environment and the right signals and the right nutrition and the right amount of love so that they can flourish. So chiropractic will always be a part of who I am. It'll always be a part of who you are, because I've impregnated these ideas into you and our family. And I believe it's the greatest gift that I've ever given myself and everyone around me, because it is really a way of looking at the world and a way of looking at ourselves that, puts us in the power position, puts us back in the driver's seat of our health. So I started off as a soft tissue therapist, chiropractic soft tissue expert, working with elite athletes, Olympians, marathon runners, people who were peak performers and injuring themselves due to repetitive strains. And I thought I was on the top of the world when I was on the news in 2006, about 2 years into being in practice. And they featured me and our practice on the news for helping people with soft tissue injuries. And as a result of that, we had a whole bunch of people call our office, and our office went from seeing some of the healthiest injured people to some of the sickest people who had tried every single solution and nothing was helping them. Now, frankly, and honestly, I couldn't help them either because the conditions that they were coming in with were not soft tissue injuries. They were not things that I could, manipulate or rub out of them or, do ART or active release technique, which is a therapy that I was doing at the time. That was not the appropriate treatment for them. But what was really gutting is that I didn't know where to refer them to because they had seen everyone, they had taken every drug, they had every scan, and nothing seemed to work for them. So I started asking them, hey, listen, I can't help you, but I'm curious what inspired you to set up this call? Because the story that was done was about a lady named Connie and how we were able to get rid of her chronic elbow pain despite having surgery and physical therapy. Nothing helped her until she came to see us. And they said, well, we saw hope. And so I took that to heart. And I didn't know what it meant at the time, but they saw hope or they saw something in me that I perhaps didn't see in myself. And so that's what around the time I started synchronistically getting emails from who would later become my teacher and mentor, Dr. Ron Grisanti. And he was sharing case studies of people who he was helping, people with rheumatoid arthritis, with psoriatic arthritis, with digestive disorders, chronic, debilitating health conditions that we didn't really learn about in school. And he was helping them get to the root cause. So I started following his work and started looking a little bit deeper into my scope of practice as a chiropractor in Ohio and realized, hey, the tests that he's running, I could run these tests as well. And the moment he offered his training and mentorship, I jumped on board. So I was actually one of the first graduating students from Functional Medicine University. So we're talking all the way back in the mid 2000s. I've been doing this for almost 20 years now, which is kind of mind blowing when I think about it. Didn't have it, I had a little bit more hair then, certainly didn't have the grays. And so I started then incorporating functional medicine into my soft tissue practice. And at the time, I was working for somebody else. So I started essentially handing all of my existing chiropractic patients a functional medicine intake form. And I learned that many of them had chronic health issues that they never brought to my attention because they thought they were coming in for their neck pain or their shoulder pain or their chronic calf issue or their lateral epicondylitis or their tennis, which is also known as tennis elbow. And so they thought that that's all we could help them with. And it turns out that that's all I was helping them with because I wasn't asking these other questions. So they started bringing these forms back in and I started realizing, oh my God, these people who think I'm helping them don't realize that there's so much more I can do for them. And around that time, luck would have it, I was being positioned to take over the practice, decided not to because I really would have had to overhaul the type of practice that it was, started working for another company at that time and, started doing functional medicine and chiropractic. And then eventually when Devin was born, I started my own business. We started it together called the Living Proof Institute. And that became really a concierge, very bespoke functional medicine consultation practice. And we started that in Westchester, Ohio. And we started what we call a micro practice. So we were one of the first functional medicine micro practices that ever existed. So we essentially created a whole new category of how to do functional medicine and how to get to the root cause. And in doing that, we started getting amazing results with our clients. I started doing a lot of community lectures and started doing a ton of workshops and really getting the message out there online and in person. And it's just, our practice just grew exponentially from there. And then, of course, because we wanted to be close to family, we decided to move back to Toronto and basically started another micro practice here. And our practice grew very quickly as well because the demand was so high and nobody was really doing what we were doing. So we were one of the first people to introduce, true functional medicine in Ontario and perhaps even in Canada. And then we built a little empire, if you will, for functional medicine in Mississauga, Ontario. And then eventually I decided to retire my license because I wanted to go bigger. And I wanted to help more people. And I realized that sometimes the constraints of having a license actually limit the impact that you can have. So for my 40th birthday, 7 years ago now, I retired my license. And it was the best birthday gift I ever gave to myself, because then I started being able to speak on bigger stages. And then I became certified in something called FDN, or functional diagnostic nutrition, which gave me the scope to help people across borders around the world, just like you do now as well, and get to the root cause. So in my journey, started off as a chiropractor, still am, then went into functional medicine, then became an FDN. And then a few years ago, I also became a breathwork facilitator. And but by becoming a breathwork facilitator, I've also been able to help, thousands of people regulate their nervous system, help hundreds of practitioners learn more about the power of pranayama and breath control so that they can regulate their nervous systems. And now you and I have developed a program over the last 8 years now called Living Light. And Living Light is essentially what I would consider the most impactful, simplest, most affordable, and most results oriented program that I've ever seen. And what it essentially does is it helps people get back in the driver's seat. It teaches them how to nourish their bodies in many different ways, nourish their nervous systems, nourish their cellular health, nourish their circadian rhythm, nourish their restorative systems, nourish their mitochondria, and the list goes on and on and on. And when we put these, pillars in place, amazing things start happening. People experience rapid transformation. And just recently, we started licensing this program to practitioners. So now we've got about 80 practitioners that are now using this system in their practices. And the goal is to have thousands of practitioners using this as well, because the results are reproducible and the results are quite profound. So that's a bit of a nutshell of what I do and why I do it. And just to also maybe highlight one more thing, because we opened up multiple locations and had such great success in running our business, my colleagues also started wondering, hey, Sachin, what are you doing? And can you teach me? So about 10 years ago, I started mentoring functional medicine practitioners. And that became another, passion project of mine, because I wanted to help practitioners eliminate the mistakes and the hardships and the challenges that I went through to get their practices up and running, and really accelerate the holistic health movement. And so as an entrepreneur and business owner, I teach them, business principles. I teach them spiritual principles. I teach them practical lifestyle principles. And of course, I teach them clinical principles to get their businesses up and running, producing successful outcomes for their clients, producing, successful results for their business as well.
Wow. Thanks for sharing that. It's been, when we reflect back on how long we've been on this journey, it doesn't feel as long as it, the path that you just outlined, but it's been since 2013, right? It'll be almost 12 years in September since, we've started this business. And I know one of the things that
2011 is when we started.
That's right. Sorry, 2011. I'm thinking 2013 because that's when we moved back to Toronto. But yes, you're right, 2011. So yeah, almost 14 years since we've started this practice and this movement. And I know one of the things that you, are kind of famous for saying is the doctor of the future is the patient. So I'd love if you could unpack that a little bit.
Yeah, absolutely. When you understand the magnitude of our current healthcare crisis, you start to understand a little bit more about what the solution is. And, most practitioners want to have a busy practice, rightfully so, but busy practices aren't actually going to solve our healthcare crisis. What truly needs to happen is a paradigm shift where people know how to take care of themselves. And I think that's the world that I want to live in for sure. I know that is the world I want to live in, that you want to live in. Nobody wants to wait until they get sick to learn how to be healthy. What everyone wants for themselves and their loved ones, especially their children, is to know how to be healthy from the very beginning. And if they can learn how to take the best care of themselves from the moment they're born, or parents can learn how to take care of their children from the moment they're born and model health to their children, that's the world I want to live in, where children are healthy, happy, and whole. They're not broken and they're not dysfunctional as children. And then eventually they get a diagnosis, and then eventually they're put on medications. Eventually, they realize that's not the answer. And then eventually they end up in a holistic practitioner's office or a functional medicine practitioner's office. And the whole time, that might take 30, 40, 50 years for them to get to that point. They've been walking off the golden path that health has laid out for them. So when we're healthy and we're happy and we're whole, your whole life looks completely different. Everything looks different. Your education is different. Your vocation is different. Your income potential is different. Your relationships are different. Your contribution to society is different. And so all these things are impacted, even if you're just a few degrees off the journey when it comes to health. Now, I also believe that this idea of health prevention or disease prevention is actually a model that needs to go away. Because just like in your GPS, you wouldn't, if you wanted to go to a restaurant, you wouldn't put in all the places you don't want to go to, hoping you'd end up at the restaurant. You'd put in the exact location you want to go to. So our philosophy is that the doctor of the future is a patient, but that also that instead of a disease prevention model, we want to create a health creation model. And that's essentially what we've done. You know, the principles that we teach in our Living Light program, in our Essentials program, in any program that we offer, is how to be healthy, not how not to be sick. And so if we can just adopt that principle, then what happens is we decrease the burden on our healthcare system. You know, we have a great healthcare system if you have an acute injury, right? You had an acute issue where you had to go to the doctor, right? You had to go to the hospital and it was an emergency, and we were able to save your life because of it, right? I have my brother, for example, broke his leg, right? And he had to go to the doctor and go to the hospital for an emergency procedure and eventually a surgery so that he could walk again, right? So that they could set his bone and put the pins and rods and everything in him that they needed to so he could function again. And so we have a wonderful system for that. And nurses and doctors and all the staff at hospitals are some of the most caring, intelligent, loving people that you'll ever meet. But the problem is that now people are coming in with chronic health issues, and they're coming in with issues that cannot be acutely addressed with a drug or a surgery, right? They're co-creating these problems. And so they have to co-uncreate these problems. And somebody has to teach them how to do that. And unfortunately, the system isn't set up to do that, right? Doctors, nurses just don't have enough time to walk somebody through what to eat or how to exercise or how to think or how to erase some of the stories that are holding them back in life and some of the narratives that are holding them back, or perhaps the environment in their home that's contributing to their chronic health issues. So, you know, I think that if we all sit down and just think about it for a few minutes, we realize that more doctors, more hospitals, more drugs, more nurses, more funding isn't the answer. The real answer is more healthy people. So then the solution becomes, how do we create more healthy people?
Yeah, I love that. And I think that that message is just so important now more than ever, is really focusing on how we can teach people how to create health in their own homes, right? I know you've said in the past that it's what happens outside of your 15-minute yearly doctor's visit that's more important, right? What we do in our homes on a daily basis, what we teach to our children, what we role model to them, is ultimately what's important in terms of determining your long-term health outcomes.
Yeah, absolutely. And, you know, as a chiropractor, you know, believing in the innate intelligence, and now it's so funny because you hear medical doctors preaching this, and they're hailed as heroes and innovators and forward thinkers, whereas, you know, chiropractic practitioners, Ayurvedic practitioners, traditional Chinese medicine practitioners, naturopaths, even osteopaths have been saying this for hundreds and hundreds, if not thousands of years. You know, so this awareness is now coming to center stage, and I'm so grateful that it is, but it's not a new message. It's been around for quite some time. And now we have the science, we have the data, and we have the transformations to prove that this is the path forward. And so you mentioned something that I think is really important about children. And so, you know, we model whatever it is to our children, right? Whether we're modeling health or disease, They're watching, they're paying attention, they're eating the foods that we buy. So the greatest gift that you can give to, your ancestors is to take care of yourself. And the greatest gift that you can give to future generations is to take good care of yourself, because especially between the age of 0 and 7, you're modeling your child's worldview. You're modeling what a healthy diet is. You're modeling what healthy communication is. You're modeling what a healthy self-talk looks like. You're modeling what a healthy environment looks like. You don't want them to wait until they're 40, 50, 60 and sick and then realize that you had it wrong as a parent the whole time, right? You want them to be grateful for the environment that you created, for the way you communicated, for the food that you provided them with, for modeling the behaviors that kept them healthy, happy, and whole. And I believe that that's the greatest advantage that we can give our children, right? It's not all the money we leave behind. That can be helpful. It's not the education that they get, because I know a lot of well-educated people who are sick and dying right now, right? Who have cancer or heart disease or some sort of chronic health issue that kind of makes that education far less useful when they're sick and unwell, right? So education may not be the best thing that you give your children. It's teaching them how to take the best care of themselves by showing them how to take amazing care of yourself. That's the greatest gift that you can give. And that's how we honor our ancestors who all came before us and gave us this beautiful body and our genetics and however you want to look at it. And that's how we honor future generations, by modeling this and putting this into our lineage, right? What it means to be healthy, happy, and whole. That's what I love about Living Proof, because it's not the I read about it in a book institute, it's the Living Proof Institute. So it's our namesake to be, functioning at the highest level that we possibly can. And certainly we're not perfect. However, I would say we're pretty darn close by most people's standards. And of course, there's always room for improvement. And we're always reaching for that room for improvement and always bettering ourselves and developing ourselves. And I believe that that's a lifelong journey. But there's really simple foundational things that people can do right now, today, in order to completely change the trajectory of their life and the life of those around them.
Yeah, I love that. And I always tell clients as well is that our children don't do as we say, they do as we do, right? Our actions are way more powerful than our words, right? They're watching every little thing that we do. So even if energetically, right, it's important as well. Like if your kids go to sleep and then, you're like, yes, I can go like eat that bag of chips. Well, energetically, it's still, they can sense that lack of integrity. So like, once again, it's not about being perfect, right? As you said, we're not perfect, but we're always striving to live to our best potential and do the best that we can.
Yeah, and the best that you can is the best you can with the knowledge that you have and the circumstances that you're in. And so, our mission and vision and why we're called an institute versus the Living Proof Clinic is because it's our mission to educate. And, we give away extremely, extraordinarily valuable information freely and openly, because that is our mission, is to keep people out of our practice. Now, of course, we want to help people. And of course, we want to coach people and hold them accountable and show them what's possible. And there are people that need to have their hand held through the process. And we're happy and grateful for the ability to be able to do that. However, again, the solution is not everyone coming to our office. The solution is people self-actualizing, utilizing the information that we share, applying it into their lives, reaping the benefits, and then sharing it with others. I mean, that's what brings me the most joy. Some of our most amazing transformations are from people that never came in as patients or clients. These are people who've been following our work, bit by bit, applying it into their lives, and their lives have been transformed for the better, not just for a short period of time, but literally forever, because what we teach people is timeless wisdom. Many people out there, and there's not a knock against anyone, but they're sharing the latest and greatest information. And it might seem relevant and practical today. And then you find out a year later, it doesn't work, right? Or you find out that this is just the next fad. So our philosophy is, would it have worked 1,000 years ago? That's the information we want to share. And could you have done it 1,000 years ago? And usually the answer is yes to the information we share. And can you do it 1,000 years from now? And will it still be relevant and practical to you? that's the question I ask myself. And that's why we focus on some of the foundational principles, such as, of course, an anti-inflammatory, blood sugar stabilizing diet. That's what we've eaten our entire history as humans up until now, right? So we know that that's worked for a long, long time, and it'll work because that's how we're wired. We also spend a lot of time emphasizing the importance of rest and recovery. That's never going to go out of physiological style, right? Like we're always going to need to rest and recover, and most people don't do that. We talk about making sure that people's nervous systems are regulated, right? They're more dysregulated now than ever before. And unless something changes inside us, society will keep dysregulating our nervous system and keep us in that sympathetic dominant state, which we know from every medical textbook is the state in which we create a survival situation. However, when that situation is prolonged and extended and is the normal state for most people each day, then they get into a state of disease and dysfunction, and then they eventually get a diagnosis of something. And hence Salier says that virtually all disease is tied back to some form of maladaptation to stress. So these are just some of the principles. I mean, lighting is another one. Our lighting has become so toxic, including like indoor lighting, a lack of outdoor lighting, right? Screen time, like all these things are negatively impacting our health. That's why we focus on that with our clients. Another thing is fabrics, the materials that people wear, right? That impacts our health. And we've been saying this for years, and now it's getting more time, on the airways, and more people are starting to realize that the materials we wear also make an impact. So all these new age and new waves of technology and convenience have created inconvenience when it comes to our cellular health and physical health, mental and emotional and spiritual health. So we're just helping people come back to center, come back to knowing who they are, how to take care of themselves, and how to take care of the people around them, so they can experience all the beauty and joy and love and all the things that life has to offer.
Yeah, I love that. And I think, it's really important in terms of emphasizing the foundations, right? And I think it was 2018, we went to India, and we had some pretty long drives going from place to place. And, I was just looking out the window and observing what was going on. And time again, I would see a lot of homeless people, right? There's a lot of homelessness in India, but I witnessed how the homeless people are actually doing everything that we tell our clients to do, right? They're out in nature, they're in community, they're getting natural sunlight, they're eating, whole foods, they're, sleeping once it gets dark, right? So it's really a remembering of going back to the basic principles, which have, as you mentioned, it's that timeless wisdom, right? That are, no matter whether it's 100 years from now, 1,000 years from now, these are principles that we as human beings are genetically wired to live by. So that really, I think over the years, as our journey in functional medicine developed, we realized that, of course, the testing has a lot of value, functional lab testing, but most people are not doing the basics, right? And that's really what we really want to emphasize with our clients and with our community, is having people going back to the basics.
Yeah, and I may highlight an example of that, and something that people can apply immediately into their lives after listening to this, or maybe even while you're listening to this, if you're eating, is we would have so many people come to us who had seen multiple practitioners, very well qualified and well-meaning practitioners. They had done a bunch of tests, like excellent labs, and they've tried a whole bunch of different diets, and nothing seemed to be working for them. And even taking supplements, nothing seemed to work for them. And we would ask them one simple question, and it's not just about what you're eating, but how are you eating? And that seems like such a simple, paradigm shift. But how you're eating would include things like, are you chewing your food? Right? Most people, I was having a conversation with a bunch of guys in the sauna yesterday, and we were talking about this exact topic, and all of them raised their hands and said, I eat really fast. I barely chew my food. I just inhale my meal. And so it's like kind of like the equivalent of driving through a car wash, right? Imagine driving through a car wash versus putting your car in neutral and letting the car wash do its job, right? You're going to get a totally different outcome and result than, driving through the car wash and just like blowing through the thing. You're not going to get the same outcome. So digestion is the same way. So chew your food. That's like something that I can't emphasize enough. Aside from choosing the right food and choosing the right time of day to eat the food, chewing your food is a very conscious effort and decision, and it shifts our body into a parasympathetic rest and digest state. And it's in that rest and digest state that we start sending more blood flow to our digestive organs. We start making more stomach acid to digest our food and initiate the digestive enzyme breakdown of our food. Of course, some of that happens in the mouth, but a lot of it happens in the stomach. And it creates the right conditions for the rest of the digestive system to further digest that meal and assimilate the nutrients. So something as simple as chewing your food and slowing down, getting into the right gear, can have a profound impact on somebody's digestive health and overall health. And that happens at your next meal, right? It doesn't take months for you to see an improvement. Literally, people can get rid of bloating within 1 or 2 meals just by chewing their food, by reducing the amount of fluid they consume with their meals, by slowing down and enjoying that meal. And what's also fascinating, Deepa, is I know I've shared this with you and I've shared this online, is that something as simple as turning your screens off while you're eating. Studies have shown when people eat in front of a bright screen, it actually increases their blood sugar more than just the food does. So you could have 2 people eating the exact same meal, same calories, right? And we'll talk about calories in, calories out another time, but the exact same calories. But if one person ate that meal at the right time of day, slowed down, chewed their food, was eating with full presence and awareness, versus somebody who's eating that meal at midnight in front of a TV, barely chewing it while they're stressed out, checking their email, right? That's going to have a totally different effect on them. So we want to actually teach people how to live. And when they learn how to live and how to use their body as a vehicle, then amazing, amazing things start happening. And it doesn't take long for them to see results. So I thank you again, Deepa, for sharing your story today. And I'm so excited for our future episodes and the information that we're going to share, the guests that we're going to bring. I'd love to know, is there anything that you'd like to add before we sign off today?
I think we, gave people a good foundation in terms of what our philosophy is, a little bit of our stories. And of course, I know you talked a little bit about digestion in terms of how we're eating, which we'll unpack a little more in future episodes. I know one of the things that you talk about is the 5 C's, which we'll definitely unpack in future episodes. But, if anyone does want to, learn more about Living Proof and our mission, where do you think is a great place for us to direct them?
Yeah, I mean, certainly you can go to thelivingproofinstitute.com if you want to check out our homepage. From there, you can opt into our morning routine. We've created what we consider to be the optimal morning routine for metabolic health and weight loss, which most people could use and benefit from. And then we also have a whole bunch of other resources that you'll find there. But I think that's a great place to start. And once you get on our list, you'll be invited to webinars, you'll get invited to special events that we host and presentations. And of course, subscribe to this YouTube channel so that you get all the episodes as they roll out. And we're going to bring some amazing guests to you with awesome topics. And you're going to love the practical information that we share. So thank you all for tuning in today. Thank you for your time, your attention, your presence. We realize and recognize that's the most valuable thing that you can offer to yourself and to others. And we greatly value and appreciate it. So I hope you learned something new about us. I hope you learned something new about yourself, which is that you are amazing and you are healthy, happy, and whole. And we want to keep you that way. And I hope you learned a little bit more about, what next steps you can take to learn practical steps to take better care of yourself. So here's to health, happiness, and wholeness for all. Lots of love to all of you. Lots of love to you, Deepa. Thank you for joining me today and being my co-host on this new series that we're launching and this new initiative that we're taking. I appreciate you, and I'm so grateful that we get to walk this path together.
Thank you. I appreciate you too. And thank you for everyone for being here and listening.